House Bill 71. The gentleman from 10.
Mr. Speaker, I ask unanimous consent that we suspend the reading of H71.
Unanimous consent has been requested. Is there objection? Hearing none, the gentleman has the floor.
Thank you, Mr. Speaker. This bill is about children. I can't emphasize that enough. It's not about adults. This is about children. Before I get further into the merits of this bill, I want you to keep in mind the first paragraph starting with genital mutilation of a child is already in statute. That's not what we're here to discuss today, not the Section 1 or the first part of this bill. Section 2, sexual mutilation or sex change procedures on children. That's what we're here to talk about today. Section 3 has all the necessary exceptions that should be there in medical practice, and so that Section 10 of this bill was drafted in collaboration with medical professionals who practice in this area and have published topics in peer-reviewed medical journals. This bill, again, is about protecting children from sterilization and removal of sex organs, healthy sex organs. It's about outlawing mastectomies on girls for sex change purposes. The prison time is limited to up to 10 years for any medical practitioner who does these procedures. Removal of genitals and reproductive organs make a child sterile, no doubt about it. Cross-sex hormone therapy sterilizes a child. Puberty blockers may sterilize a child depending on how long they are used. They stop the natural process of puberty depending on the length of use. For instance, kicking a girl into menopause when she's 13 years old when they start these. Shrinking the testicles of a boy. Once that puberty is passed by those years, you can't go backwards and get puberty back. Mastectomies on minor girls prevent forever their ability to nurse a child. Should we pass this bill on the floor, House floor today, no, we do not stand alone. At least 20 states are already passing bills or have passed bills similar to our own. Those that have passed criminal penalties are being upheld in the courts. While they're on appeal, they're in force. So right now, that's happening across our country. Gender dysphoria is a term applied by psychologists for children confused about their sex. It's a very real thing. Children are confused. They need talk therapy. We want them to have all the therapies traditional. Most children will work, studies show, most children, some studies at 98%, if just talked through, allowed to go through puberty, will naturally come out of that gender dysphoria. Now, gender dysphoria, it's important, is a mental illness by all psychologists, psychiatrists to be dealt with. But most of the kids that come forward with gender dysphoria have other illnesses, mental illnesses, bipolar, severe depression. Many of them are on the autism spectrum, or they've had severe trauma in their life, usually sexual trauma. Those things in the race to get the gender mutilation stuff going on to them, or I should say transgender sex changes, those things are not being addressed. That's what we're being told, and that's what we're being found out by studies that are coming out even now. And a lot of places in the world are pulling back from these procedures on children in particular because the data just is not there to support that it helps them. It's doing more harm than good. The puberty blockers, the transsex hormones are being found in some countries and studies to be as serious as the actual surgery itself as far as long-term consequences. You hear about suicide. Well, I have to have this done on my child to prevent suicide. The data, there's no long-term study or data or even that supports that stops suicides. In fact, the latest data that's out there shows that suicides increase once all of the surgeries and procedures are done when it starts in childhood. And that's why you have nations pulling back that were once supportive of this. This is not a religious crusade on this bill. This is following the science. There's a sad history of sterilizations in America for those who study history know about. And sometimes in our history, sterilizations were popular in medical circles to improve the race, to eliminate procreation of the feeble-minded or those of low IQ. Other things were popular in medical circles that I'm sure you can think of that are now we know were evil, outright evil, lobotomies, or even more recently, the opioid crisis. It was popular in medical circles to give everybody opioids. What a great thing. That's how we deal with pain. We all know people who got hooked on those opioids badly. And now we're seeing the consequences in our nation as the medical field pulls back on that, and rightly so. In this wicked past having to do with sterilizations, our U.S. Supreme Court weighed in on the matter about 80 years ago, declaring all Americans have a fundamental right to procreate. Fundamental rights, a higher standard that we need to protect. Can parents and counselors decide to permanently deprive a minor of the right to procreate that's protected by our Constitution? Before those children have legal capacity to consent to such things? No, should not be. There's a host of things that parents cannot consent to on behalf of a child. They should not be allowed to consent to the sterilization of another human being, even if it's their own child. Science is on the side of this bill. At best, opponents of this bill must agree there is uncertainty on the benefits of sex change procedures on children. Mr. Speaker, I ask unanimous consent to read briefly from Supreme Court decisions. Quote,
Unanimous consent has been requested. Is there objection? Hearing none, the gentleman may read.
Thank you, Mr. Speaker. In 2007, the U.S. Supreme Court determined state governments, that's us, quote, have wide discretion to pass legislation in areas where there is medical and scientific uncertainty, unquote. There's certainly uncertainty on how this affects children long term. The U.S. Supreme Court recognized the right to procreate is a fundamental right under the 14th Amendment, and one who suffers from sterilization, quote, is forever deprived of a basic liberty. We as a legislature have a duty to protect these children from the permanency of these procedures. They are permanent. To protect their fundamental rights, that is our duty. Last I checked, even the federal Medicaid program does not allow parents of a minor child to consent to sterilization procedures. Now there's talk, we talked about the prevention of suicides. There's no credible evidence these surgeries on minors reduce the likelihood of suicide. The best way to reduce suicides in children is to give them traditional talk therapy, counseling, and care as they go through puberty and these confusing times of life. And to let them just have their puberty. Let them alone. If the law does not allow a child to get a tattoo, smoke cigarettes, drink alcohol, sign legal documents that are binding for credit cards, to get buy a house, why would we allow them in this tender state of mind that is under 18 to make decisions on having their bodily parts, healthy bodily organs removed? And really, a lot of this is based on what the child's feelings and thoughts are going forward on these procedures. That's the wrong way to approach it scientifically. I could talk on this a long time. As some of you know, I've lived this bill for 2 years, and I'm not going to do that. Mr. Speaker, I ask for your green light.
Thank you. Good gentleman. There's further debate on the motion. The gentleman from 16.
Thank you, Mr. Speaker, to debate against the bill.
Gentleman has the floor.
Thank you, Mr. Speaker, and thank you, good gentlemen, for your presentation. I want to speak to what we heard in committee on this, and from my own personal experience, having a sibling who is transgender. I would say it was largely an experience prior to that was foreign to me, something that maybe feelings that I had never felt before. So sometimes it's difficult to empathize with folks who might be feeling these types of feelings. And with that, it's very difficult to put ourselves in their position and even to legislate for what they need in their lives. That got really real for me when a member of my wife's family took their own life over issues related to their transgender status. And although I may not understand it, I believe them. I believe them that they feel differently and they want the world to see them differently. And I hope we would too. And when I read this bill, it's not consistent with what the experience was in my own family dealing with this. The surgeries that are put forth there are not something that I saw in the standard of care for my own sibling. And largely, that care is helping a child feel understood, accepted, and helping them to a place where they can safely make these decisions on their own. There's a lot more I could say, but I would just leave it at that I hope for those of you who have someone in your life who is transgender, that you would find a little empathy for them and use what you know from your personal experience to see if this bill is really criminalizing things that are happening in Idaho, because that was not my experience during the committee testimony. Thank you.
Thank you, good gentlemen. Is there further debate on the motion? Hearing that, good lady from 19.
Sorry, Mr. Speaker. Thank you, Mr. Speaker, to debate the bill.
Lady has the floor.
Thank you. I would like to talk a little bit about what gender-affirming care is, because I think it's unfamiliar for most of us. For young kids, gender-affirming care is therapy, psychological assessments, and social transition. Loving parents go and get some professional help, and they might start down the path of allowing a child to, do their hair differently or dress in different clothes, so that they can present at the gender with which they identify. It might not be until years later, when puberty is starting to happen, that they start to consider puberty blockers. Puberty blockers are simply a pause on that development. And there's something that we've been using for decades for something called precocious puberty. In some cases, an 8-year-old could start puberty. That's too soon and not safe. And so puberty blockers are used to simply put a pause on that and put a pause on puberty developing, so that decisions can be made later. We know that puberty blockers are safe after these decades of use. There's no difference in fertility for males and females after treatment when compared to the general population. They are reversible. So it shows that within 12 months, max, puberty has resumed when puberty blockers are halted. There are no studies showing clinically significant changes to bone density or brain development or any of the other things asserted in this statute. And it is concerning that we have factual inaccuracies that are contrary to mainstream medical consensus proposing that we're going to write this into statute. Once patients are far along in their care, later in teen years, then they might take hormone treatments. And then we could have the debate about surgeries. They're not part of the standard of care for minors. They're not happening in Idaho. So they're just simply irrelevant.
Water, a center for the study of food, offering degrees in culinary arts, artisanal food, baking, beverages.
Parents and honor their rights to navigate this process and make these decisions for their kids. The parents of gender diverse kids are loving parents. They are generally learning as they go on this journey, and this journey demonstrates that they are open to what their children are experiencing, and that something wonderful is happening in these families where children can approach their parents and tell them about this scary thing that they're experiencing, and it's something that can be hard to talk about. So when we talk about these parents, they're open, loving, and really trying to do the best for their kids. They're doing what I would think most of us would do. We try to understand the situation and get professional help. But it's a scary moment when parents hear about this and kids start to have gender dysphoria, because it is often marked by depression, anxiety, and suicidal ideation. And I can't imagine anything scarier than being worried that your child could take their own life. When kids can't get access to affirming care, it's a whole new world. And I've heard the stories from parents about the relief they experience when they can see that their children, through care and support, can begin to thrive again. And these results are backed up by quality research. I had distributed just a couple of studies about the improved well-being that is observed when minors can receive gender-affirming care. They have significantly lower odds of depression, anxiety, and suicidal thoughts. Multiple longitudinal Dutch studies show that children with childhood dysphoria who receive puberty suppression, gender-affirming hormones, or both, found that none of the youth in adulthood regretted those decisions they made in adolescence. In a US study from last year, 24% of transgender youth were stable in their transition. These are the results of peer-reviewed quality research articles. This is the same standard that you would want your doctor to use this level of research in treating your cancer, your heart disease, or a stroke, etc. The mainstream medical associations all support gender-affirming care based on the positive outcomes they're seeing from studies like these. But for the parents of children in Idaho, these results are a godsend. And I can only imagine the terror and uncertainty they're feeling with the specter of this bill that could take away the treatment that is transform their families and making them feel safe. You know, this is something that it might be new and might cause discomfort for some of us to think about, and might feel abstract. Some of us might not have had the opportunity to sit down with a transgender adult and learn about their journey, or sit down with a family and hear what they're going through. And I would encourage anyone to do that and to listen to those stories, and also try to channel what that might feel like. To imagine you as you are, you know, waking up in the body of the opposite sex. What would that feel like, and what lengths would you go to feel at home in your bodies? These parents love their kids and want them to be able to live as their authentic selves. And I'm sure they have conflicted feelings as well, and fear about whether their kids will be accepted, included, and what kind of a path they will have in life. And so I ask us not to make that path any harder. Like many of us, I have a fervent group of internet trolls who like to attack me. Sometimes I think they get up, make their coffee, and then decide how to make my life miserable for the day. Because I support the rights of parents who I think know their children best to make these decisions, the internet trolls have come after me, saying things like I support surgeries on 5-year-olds. That's not true. I don't support that. It's not true, and it's not happening. But it doesn't hurt me. I can live with those attacks. We all understand that's part of this role, because we need to still come here and vote on our principles and protect the vulnerable, despite what the critics say. So I can live with the attacks. What I can't live with is one single young person taking their life because they couldn't get the care they need. I beg you to vote no on this bill.
Thank you, good little lady. Is there further debate on the motion? Good lady from 6.
Thank you, Mr. Speaker. I rise to debate the bill.
The lady has the floor.
Thank you, Mr. Speaker. Colleagues and friends, I stand before you in conflict, and I wanted to just share a few things with you today. I am in agreement with some parts of the bill, and I am in disagreement with other parts of the bill. I sat with 5 transgender parents, who are transgender parents of transgender children, and a transgender young woman, 16, yesterday. I have had the same experiences in my family as the good gentleman from 16 that has affected me and in my decisions, and the experiences that we have, that we bring here to the table. They shape our decisions, they shape our thoughts. And when one goes through those, you look at this a little bit maybe differently. I agree that children under 18, that the surgery should not happen. The transgender people I've chatted with, they also say, they agree that the 18 is even young to have the surgery. And they were not at all opposed to having a law that said children must wait till they're 18. However, there was tears, there was very uncertain futures that they also shared with me, that if they were not allowed to have the medications necessary to help them on their journey, that it would be devastating for them. And the puberty blockers that they are on for a shorter period of time than what the good gentleman from 10 is referring to. And the standard of care that these folks are on has them on blockers so that it can pause, as the good lady said, to allow them to feel better about themselves, to move forward in their journey, wherever that might lead them. It was very interesting to me that not one of them said their children had any desire to go ahead with sex reassignment surgery. And I call it that because I think that's what we need to call it. And as the gentleman said, we're not debating the title to that law, but maybe at some point we need to. I just want to say to you that I am conflicted with this bill because there's too many parts in it. If it just said, let's not allow the surgery, my green light's on very quickly, and that's an easy decision. But when I'm taking away these, the parents' rights, and that's what we fight so desperately, and we say the parents have unalienable rights to make decisions for their children. But now, since we don't understand or we don't like this topic, we're going to say, no, parents, I'm sorry, we are the legislature and we know more and we know better what is important and what your child needs. And that bothers me greatly. I think about myself in the position, and I did put myself in these positions of saying, what would you do, Lori? What would you do if it's one of your 4 children or one of your 11 grandchildren that are struggling with this very issue? Well, I would fight like all get out to get them the treatment, whatever that is that they need. And my concern is that these parents now will go to alternative means to find the medications that their children need. So are we closing that door and saying, sorry, again, we're the legislature and we know better? And that is troubling. I've lost a lot of sleep over this bill. I've wrestled with it. I've talked with professionals. I've talked with medical folks, parents. I've talked with actual transgender people. And I want them to know that I care, I feel for them, and it is real. It is something that is real that we all need to try to understand. It's difficult. When the situation happened in our own family, my first reaction is, oh, you've got to be kidding me. This can't be happening. How does one get married and then want to become a man and you're a female? It's like, I had a hard time wrapping my head around this, but it affects me. It affects their lives. It affects my grandson and his partner, his wife. But I love them dearly and will do anything I can to make life easier for them to get through day to day. So my wrestle is I have to vote. Yeah, I could get up and walk out the door and not vote. And I see that happens once in a while, but I felt, no, I have to stand strong. Our good pastor said to us yesterday and gave us the great general's quote, if you remember, and I can't quote it exactly, but you know, leadership is about standing strong, and sometimes you stand alone. But so I rise because I know I'm standing kind of alone as a Republican, but I also am saying to my fellow Republicans, the platform goes very specifically about parents and parents' rights, and we have fought for that. And in saying all this, and I will sit down so we can move forward, but my heart is with these people, these lovely individuals that I've met, and they touched me deeply. I will be voting yes, as a surprise to many, because of the surgery, because I believe strongly that surgery should not happen in anyone that is under 18. I would love a pause on this bill. I would love to say, good gentleman from 10, please take out the puberty blockers, because I think that we are jumping the gun and we as a legislature are reaching too far, and that is not right. But I will also reserve the right to come back to you as this body, to go to the good gentleman from 10 and say, here's some new data. Here's some clear and convincing data. Because I don't believe right now that the data that I have read is clear and convincing that I can say without a shadow of a doubt, these children are going to be disfigured and harmed from taking the puberty blockers. It can happen. But under the standard of care, when a child is given these blockers, they are being monitored by a doctor, by a psychologist, a psychiatrist, or a counselor who deals with gender dysphoria. And so I appreciate you all. I know this is a difficult decision for you. So I'm not going to say I hope for a green or a red light, but just know this is I take it very seriously, and it's very comforting to know that I have a lot of friends in this body. But so we all have to vote our conscience, and so thank you, Mr. Speaker.
Thank you, good lady. Is there further debate on the motion? Hearing none. Lady from 18.
Thank you, Mr. Speaker. To debate the bill. Thank you. I very much appreciate the thoughtful comments of the good lady from District 6. But I would say that we can have it all. We can bring another bill that addresses only surgery. And frankly, surgeries are not happening in the state right now. It's not the standard of care. And so I'm very concerned at banning something that is not happening and taking along with it a ban on something that is happening and that is saving lives right now, and a ban of which will cause indescribable pain and difficulty to many families in the state. Now, one thing I want to clarify, I think we all intuitively know that teenagers are very flighty. They change their mind about a lot of things. I think that may be part of what's driving this is, hey, a kid might think they're transgender at this age, but they might change their mind later. So let's not let them do crazy, irreversible things when they might think very differently when they're 22 years old. I get that. I have 4 kids. But a couple things on that point. First of all, these treatments are not administered unless there is a standard for this. It has to be persistent and consistent. Nobody's going to give these kids treatment if they just woke up last week and decided they think they might be a different gender. Treatment is only considered when there are those rare cases where a kid has known basically since birth that they were born in the wrong body. Rare outlying cases. Again, this is not for kids who just had a sudden flight of fancy on this. But another point is that there are irreversible permanent changes that are going to happen if the family doesn't act, if the family doesn't take these, if it doesn't administer these puberty blockers. Puberty will happen. Puberty will carry out permanent, irreversible changes on your body. You can't decide when you're 20 years old to not go through puberty. Once you're 6'2" and have broad shoulders and an Adam's apple, you can't undo that. And if you have decided you want to permanently transition to female, it might make your life more challenging in terms of, you know, how that transition is going to work out. These puberty blockers buy you time to make those decisions and put off that permanent change that's going to happen. So I think it's not the case that, you know, oh, just make them wait till they're 18. No harm, no foul. They can decide then. Permanent, irreversible things will have happened by the time they're 18 that cannot be undone, and that person will have to live with for the rest of their lives. But, you know, I get that this isn't going to be an easy decision. You might get it wrong. The kid might get it wrong. The family might get it wrong. It is possible that they will undergo this transition and someday regret it. Although I would point out that those cases are very rare, and there are a good number of studies on this. And in Sweden, there was a 50-year longitudinal study of 767 transgender people that found only about 2% expressed regret. There was a Journal of American Medicine study. Generally, I think there was one in the US that found about 3% of respondents who had transitioned and detransitioned. It's possible. It does happen. But I think there's a reason. I understand that there was a young lady who came in and spoke, who detransitioned. I think there's a reason she had to be flown in from California because nobody could be found in Idaho who had transitioned who subsequently regretted it. It's rare. It's possible, but rare. So the question is, are we going to force 97% of people to forego treatment that they deem necessary and life-saving because there might be 3% who will subsequently regret it? I don't think those numbers add up. But beyond that, okay, mistakes might happen. Who's going to be the one to make those mistakes? Because someone might get it wrong. Might get it wrong either way. You might undergo the transition and be part of that 3% that regrets it. Or the youth might not undergo that transition, might not undergo those puberty suppressors, and might end up taking their own life or having a severely diminished quality of life for the rest of their days. And we know that we're looking at a population that has over 50% suicidal ideation and attempts. So this is a very, very serious threat. This happens in the medical world. This is not an outlier. There are so many other contexts where a parent might have to make this decision. If a child has a heart defect that gives them a 5 to 10-year lifespan, do you do might create a 30% chance that they die immediately? Do you do brain surgery to address a low risk but possibly fatal hemorrhage if it causes the child to go blind? Do you do surgery that might prevent seizures at the cost of losing the function of your right hand? There are a million scenarios where there are win-lose, where something might go right, something might go wrong. And the costs are incredibly high. And the risks are incredibly high. Who is the one that's going to make those decisions? Are we going to take all those decisions away from parents? Or are we going to let the parents make that call with consultation with the best doctors they can find? In every other scenario, even when the risks are life and death, even when the risks are incredibly substantial, we let the parents make that decision. And here, I don't think that this is such a unique outlying scenario for many of those others. Again, particularly when we're talking about reversible puberty blockers. This is something that should be in the hands of parents, and this is not a crazy decision for them to make. They're talking about treatment that is endorsed in the appropriate circumstances by the American Medical Association, by the American Association of Pediatricians, by the American Endocrine Society. There is a lot of medical evidence on their side from extremely authoritative sources that suggests this is not a totally crazy thing for parents to be doing. And again, this is done after months of deep thought and consultation with experts. But again, this body, you know, again, it's a sore spot for some, but this body has chosen to allow parents to withhold life-saving care, to let children die because they care so much about parental rights. And yet we're not going to let parents administer potentially life-saving.
I'm going to refer to other legislation. I think there's a rule that needs to be suspended, and I think that there was an attempt to refer to other legislation that's in the Judiciary Rules Committee.
Good lady, continue.
Yes, thank you, Mr. Speaker. I was actually not specifically referring to any pending legislation. I think this has been an issue that's been before the state for upwards of a decade, so I'm actually not particularly referring to any piece of legislation, just the overarching state of Idaho law.
Mr. Speaker, the rule is very clear. Whether it's been before this body or not, you have to suspend the rule or ask unanimous consent. And so she is letting us know that she's trying to refer to other legislation.
Mr. Speaker, I'm referring to the overarching Idaho law in place right now.
The overarching broad.
Thank you, Mr. Speaker. I'm referring to the existing state of Idaho law, which permits parents to withhold life-saving care when that has resulted in a number of child deaths. That has been permitted in the state of Idaho because of this deep commitment to parental rights over children's care, no matter what, even if it kills the kid. Why would we depart from that now? Why would we take away parent rights, parent choice, to administer likely life-saving care that is endorsed by a number of very credible authorities within the medical field? This is a serious philosophical deviation from where this government has always been. It's a tough call. I grant it's a tough call. I grant it's a call that might be made incorrectly, but I think it's a call that needs to be made by parents. And so with that, I ask for your red light on House Bill 71.
Thank you, good lady. Is there further debate on the motion? Good lady from 30.
Thank you, Mr. Speaker. To debate in favor of the bill.
Good lady has the floor.
Thank you, Mr. Speaker. As a mom who values parental rights a great deal, I just wanted to speak, first of all, to some of the overarching principles around parental rights, and then also address some of the other false narratives that I believe are developed around this issue. When we talk about parental rights, it is the policy of the state of Idaho, and a policy that I strongly support, that parents have a right to direct the care, custody, and upbringing of their children. There is no one else who is better suited to make a decision about what is right for a particular child than the parent. And I support that principle wholeheartedly. I also believe that there are circumstances where even a parent does not have authority. And we see those examples in our state statutes prohibiting physical abuse and other types of harm, specific harm to a child. Now, in terms of this particular legislation, there are some false narratives that have developed around this issue. One of those false narratives is the idea that someone can actually become the other sex. The truth is that sex is encoded in every cell of a person's body. So we may go through procedures as humans that cause us to develop some secondary sex characteristics that may look like the other sex. However, that individual is still their biological sex, responding to those hormones as someone from their biological sex would respond. We can remove healthy sexual function, but we can never recreate the sexual function of the opposite sex. And so ultimately, this transition can never go deeper than the skin. It can create the appearance, but it cannot recreate the fact. That's important to keep in mind. The other thing that I think is important to keep in mind is we keep hearing safe and effective, safe and effective. There are no problems with this. And yet I had the opportunity to spend the day with a young woman who actually underwent puberty blockers and hormone treatment, and hear her talk about how those blockers and how those hormones affected her. In describing the emotional effect of the puberty blockers on her, she said, "They made me feel numb, lifeless, empty inside." Well, it makes sense when you're messing with a person's endocrine system. In regard to the testosterone that she took, she said, "I was never suicidal before I started treatment. Even my care specialist told my parents that I would kill myself if they didn't go in this direction. I was not, in fact, suicidal. My parents were lied to," she said, "until after I took the testosterone." She said, "I became incredibly emotionally dysregulated, angry, because of the effects of the testosterone on her." Now, she began treatment at the age of 12. She had a double mastectomy at 15. Her experience was not the standard of care that we've heard described to us today. The other thing that I believe is important to keep in mind is, as I listened to her talk about her experience, one of the things that stood out to me were both the social experiences that led up to her feelings, negative paradigms about what it meant to be a woman, and fears of what it would mean for her to become a woman, some of which stemmed from a sexual assault, and others which just stemmed from negative social stereotypes. But then also the social experiences that she went through as she made the decision to not continue forward with the path that she was on. It has taken an incredible amount of courage for her to share her experiences. And she has faced consistent threats to her personal safety and her life. It's not an easy thing when social stereotypes and forces work against you in speaking what you believe to be true. I want this body to know that we did, in fact, have an Idahoan who was a detransitioner who gave testimony before our committee. But those who choose to do so do it in spite of incredible social pressures. I would not ask those individuals to face that pressure for us, but we have heard their voices. These principles are true. I'm a very compassionate person. I understand the pain that these people experience, but I also believe that compassion can't erase the truth. And so I just hope that as we vote and move forward on this bill, we will keep some of those truths in mind. Thank you.
Thank you, good ladies. A further debate on the motion. The gentleman from 19.
The district where most of us spend our per diems. Thank you, everyone.
For what purpose do you rise?
I rise to debate and joke a little bit, Mr. Speaker.
One has the floor.
And I needed to get that joke out of the way because this is not a joking matter, and I'm not here to joke about the subject matter. Like the sponsor mentioned, we've been talking about this for a couple years, so I think that my analysis and my listening and the conclusions that I've drawn, I think they're pretty thorough. And I have come to the conclusion that this is both bad law and bad policy. And I'd like to share my reasons why. And like the good lady from 6 mentioned, this is very difficult. There are lots of different ways to see some of the same things. Though I think there are some pieces of this bill where it's actually not difficult, it's not complex to see multiple sides of something. Does this bill protect children from harm? That is the overarching motivation for the bill, because we have a legitimate state interest in protecting kids. I think we all want to protect kids. Now, it matters, and I can't emphasize this enough, it matters that in my 2 years digging into this issue, I am still unable to find a single healthcare provider in Idaho that performs surgery on minors to treat gender dysphoria. Now, why is that important? It's important because most of the proposed language, sections 2A, sections 2B, sections 2D, they all deal with surgery. As a matter of proportions, it makes it seem as if this bill is really designed to get to surgery, but it doesn't happen here. So why all of this emphasis on surgery? And I think it's to distract. And so I want to draw our attention to section 2C, because when you look at section 2C, against the larger body of facts, the question becomes, are the medications being banned here known to irreversibly harm?
Joe loved it. That was his birthday present, that he would spend the night in the firehouse. We'd have a cake, and the guys I work with, they would take a milk container and they'd cut out the facsimile of a building and they'd put it on the top of the cake. And
are the medications that we propose to ban in sections 2C, are they known by reputable bodies to irreversibly harm children? And it is quite certain if you've reviewed the academic literature, it's quite certain if you've spoken to all of our professional associations, and I think this is an important piece here. When I'm talking about professional associations, I'm talking about associations like the National Academy of Pediatrics. This is a over 100-year-old group, or about 100-year-old group with 65, 70,000 members in it. for which the treatments that some of my colleagues outlined are standard medical practices. We also heard remotely from representatives of the American College of Pediatrics, which is about a 2-decade-old group with about 700 members in it nationwide, and their entire ideological bent is to target vulnerable populations and deny them care. So there might be different perspectives, but these perspectives are not equal. They're not balanced. And we have to weigh which ones are more credible. And that's what I have done. So I can't figure out how this bill helps us. How does forcing criminal prosecutions on medical providers for prescribing rigorously established and age-appropriate treatments, how does that help us? Who does it help? That's what I want to know. I think this is bad law. But like I said, it's also bad policy. Section 1 in particular is bad policy. Our increasing tendency to criminalize standard medical practices is driving healthcare providers away from Idaho. We need to be drawing them to Idaho. This bill directly undermines policy and other investments that we've made in increasing the number of medical residencies here in Idaho so that we have a pipeline of people to treat us. And I say us because I'm talking about all of us. If there are fewer physicians, it's going to be harder for all of us to go get basic health care. This bill is bad for all of us. It's bad policy. Furthermore, given the lack of Idahoans who seem to have had been negatively impacted by any of the medicines that we are proposing to ban under 2C, this is bad policy because it deviates, as some have mentioned, from the long-held principle in Idaho that parents should determine what happens to their children, even if the consequences of that decision or failure to act lead in death. That's the policy of this body, and we are deviating from that principle right now. And because it was alluded to earlier, it is important to note that the one Idahoan that we did hear from who is supportive of this bill moved here last year, and they were an adult when they underwent these decisions. So their perspective is much different. We, the government, are not knowledgeable. We are not medical experts. I don't think our decisions are better than those of reputable organizations. Secondly, the framing around this bill is bothering me. The framing of how this bill has been presented to us. If we vote yes, then we want to protect kids. But if you vote no, you don't care about kids. You don't care that they're being harmed. That is not the decision that we are being faced with. That is not the choice we all have, okay? We don't have to vote yes just to signal that we care about protecting kids. We
Mr. Speaker,
right today to protect kids.
Good lady.
Yeah, objection. We're starting to get toward motive as to why people are bringing certain pieces of legislation. I think maybe we need to clear that up.
Caution the good gentleman to keep it to the bill. Keep going with your debate, but don't.
Thank you, Mr. Speaker, and I assure the good lady that I would not be talking about any of this but for this bill, but I will make sure that I try to stick to the four corners, as we like to say. So we don't have to signal that we care for kids. We can do something right now. We can actually care for kids. And I want to. I want to do something for this particular set of kids because these kids are the most vulnerable among us. They self-harm and they take their own lives at disturbingly high rates. And this bill is just going to throw gasoline on that problem. It's bad policy. So I will conclude with what I know. Not what I think, but what I know. You might not personally know someone who is transgender. You might think that kids are being influenced to go and change their gender, or that this is some sort of fad. But I've had the great privilege of befriending a number of people who are transgender and their families, both in my district and out. And I am amazed at how brave and bold they are, just trying to live their version of the freedom we espouse. But we can't even let them do that. It's not possible to sit down with them, hear about the challenges they face, and then think this is a good idea. It's impossible. I've been diligent in my analysis. I don't think there's any need for this law. Especially since most of the therapies this bill designs to address aren't administered on a single kid in Idaho. No healthcare provider in Idaho will do surgery. Doesn't matter if you've been in mental health therapy for 2 days or 2 years, they will not do surgery on you. They will not remove body parts. They will not add body parts. That doesn't happen. So we need to focus on the issue. And by banning relevant medications, this vote is almost certainly going to harm some kids. By removing from an otherwise concrete regimen of treatment protocols, taking a key piece of that variable out. Like having a bunch of firefighters show up to a fire but with no fire truck. They need pieces of the puzzle, and we're just removing a key variable in that treatment regimen. Whether we understand it or not, gender-affirming care is suicide prevention for the vast majority of our kids. So I think you should vote no to prevent youth suicide. Thank you, Mr. Speaker.
Further debate on the motion. Gentleman 15.
Thank you, Mr. Speaker. To debate against the bill.
The gentleman has the floor.
The last person that I would seek out for medical advice is a politician. I'll be voting no on this bill.
Is there further debate on the motion? Hearing none, the gentleman from 10 care to close.
Mr. Speaker, by the look in your eye, I'm thinking you don't want me to close very long.
The gentleman, I think, is looking at everybody else's eyes.
If you'll bear with me, Mr. Speaker, I do need to correct a few things on the record.
The gentleman has the floor.
Thank you. First of all, the studies referenced by the good ladies from 16 and 6 are not applicable to this bill. Those studies were for children in precocious puberty, so the 8-year-olds, and they were used only for a short amount of time. The puberty blockers issues I'm talking about are those used on adolescents, and they do cause permanent damage if used for a long time. On the 8-year-olds, there is an exception for that kind of thing in this bill when there's the precocious puberty. So that was taken way out of context. Finland, France, United Kingdom, Sweden are all pulling back right now from these procedures on minor children, in part because they say that children cannot decide for themselves these things, and they're seeing bad results. These are not liberal leftist places.
Objection.
The gentleman, what states your objection?
The gentleman is adding facts that were not brought into the original debate.
The good gentleman was referring to the studies that were brought earlier, if I'm not mistaken, so I think he's probably in order as long as he doesn't go out of bounds of what was mentioned during earlier debate.
Thank you, Mr. Speaker. I appreciate that admonition. Those 4 countries, and we talked about European countries, are pulling back from these procedures because of the results. They're not seeing a decline in suicides of children who have gone through all of these procedures, even into adulthood. There are no long-term studies that show that it prevents suicides because it hasn't been going on that long. And the results for these countries that were ahead of us on these procedures are pulling back now because they've seen it longer, and they honestly are not liking the results they're seeing in helping children. This bill is about protecting children. And we had Idaho physicians who work in these areas testify at committee, in person, online, or sent letters that were pretty persuasive to me. One was a physician out of Twin Falls. He said, I'm not for or against this bill, but there's no credible medical evidence that shows that these things, puberty blockers, cross-sex hormones, or these surgeries help our kids. They're just not there. And that's the area he practices in. Are these surgeries occurring to Idaho kids? They are being referred out of state for the surgeries. The puberty blockers and cross-sex hormones do as much harm as the surgeries on long-term of the child, whether they're able to procreate and have normal sexual function, even if pulled back. So I could go on a long time, Mr. Speaker, but I will stop, and I ask for your green light on this bill. Thank you.
Thank you, good gentleman. You've heard the motion. Clerk will unlock the machine, and the members record their votes. Has every member voted? Is it all good? Does any member wish to change their vote? Clerk will lock the machine and record the roll. 58 ayes, 12 nays, majority having voted in favor of House Bill 71. House Bill 71 has passed the House. Is there correction to title?
No correction to title.
Title's approved and the bill be transmitted to the Senate. Good lady from a